Hi, this is Josh, pharmacist with Pharmacist Tips. Going to discuss the medication metoclopramide today. We'll talk about common uses as well as some off-label uses. We'll discuss dosages and some of the side effects that may occur with metoclopramide. First off, let's start with an overview of metoclopramide. In the US, it's sold under the brand name Reglan. It was approved by the FDA way back in 1979, so it has been on the market for quite some time. It works by blocking dopamine receptors. That helps improve gastric emptying, helps the stomach empty properly. It does enhance movement in the GI tract, so the intestines move properly as well. It can increase lower esophageal sphincter tone. So that's a little muscle at the bottom of the esophagus that can help improve reflux and different heartburn symptoms when we increase the sphincter tone. And it's available in tablets, injection, and as well as nasal spray. So what are the approved uses for metoclopramide? It is approved for nausea and vomiting. We see that used to prevent nausea and vomiting from certain chemotherapy, after surgery, certain situations where nausea and vomiting can result. They'll use this as a pre-med to prevent that. It is also approved for use in diabetic gastroparesis. When diabetics, their stomach doesn't empty properly or as timely as it should, the medication can help improve that. Now we'll look at the off-label uses of metoclopramide, meaning it wasn't approved to be used for this, but over time in certain situations they found it may be useful for patients with these conditions. That can include malignant bowel obstructions, gastroparesis in non-diabetics, dyspepsia, heartburn, bloating, that sort of thing, probably due to helping the esophageal sphincter tone. It can help with hiccups, certain migraine headaches and other headaches, rebound headaches from certain medications. It may be used off-label in situations like that. And just general nausea and vomiting, vertigo, and pregnancy-induced nausea and vomiting, as well as off-label use for increasing lactation. So mothers who don't have enough milk for their child, the doctor may prescribe metoclopramide. It only works somewhere in 50 to 80% of women who take it, but it may be used in certain situations where there isn't proper lactation to nourish the child. What about common dosages of metoclopramide? It varies greatly. It is not used a large amount anymore, and typically we see it used for very short durations. Nausea prevention, 5 to 10 milligrams as a single dose. Sometimes you'll see this used prior to taking a bowel prep in preparation for a colonoscopy. Taken about 30 minutes prior to drinking the preparation can reduce some of the nausea associated with that. For gastroparesis, anywhere from 5 to 10 milligrams, 2 to 3 times a day, about 30 minutes prior to a meal. Therapy is always limited to 12 weeks, and we'll get into why when we talk some of the side effects that can occur. Lactation doses, usually about 30 to 45 milligrams a day, usually as a single dose or split into 3 times a day dosing for up to 2 weeks. The most common side effects that we see with metoclopramide include drowsiness, fatigue, restlessness, and some people report a change in taste. Many of these side effects are very mild, and as I said, oftentimes metoclopramide is used for extremely short duration, and if any of these occur, they typically reverse fairly quickly. So tardive dyskinesia is a warning I alluded to earlier. It is a movement disorder, and it is often irreversible. It's characterized by repetitive involuntary movements, oftentimes in the face. There are really no effective treatments. However, many times it will reduce in severity when you stop the medication that has caused it. It does increase with the risk increases with the duration of use. So that's why treatment is limited to 12 weeks to prevent the chance of tardive dyskinesia from occurring. The drugs that we would want to avoid, if you're on these medications, metoclopramide should not be used. Your healthcare provider can help you navigate that, but amitriptyline, bupropion, antipsychotics, SSRIs, so common SSRIs like Lexapro, Prozac, Celexa, many times it can increase that risk of tardive dyskinesia, so it is recommended that you not take metoclopramide if you're using these medications. Other medications include linezolid, MAOIs, digoxin, tacrolimus, and levodopa. Be sure to let your doctor and your pharmacist know all the medications you're on when you're filling this prescription as well as any other medications, so they can always screen for potential drug interactions. I do hope you appreciated this video. If you did, I'd love it if you'd like this video and subscribe to my channel. And as always, remember, this is informational purposes only. It's not intended to replace your healthcare provider. Thanks again for watching.